Our top stories this morning is this potential outbreak, or this outbreak of the so-called coronavirus. And joining us live now is the Health Minister, Greg Hunt. Minister, thanks very much for joining us this morning. Can you give us an update, first of all, on what was to be a confirmed case in Brisbane? Do you have an update on him? Has he been cleared, or potentially has he still got it?
Okay, so the latest is there are no confirmed cases as yet in Australia. There is a man in Brisbane who is in home isolation. His symptoms have subsided. We're waiting on the pathology results, and when they've been provided, then we'll provide public commentary on that. At the moment, though, there are no confirmed cases. A number of people have been tested in Australia and been found to be negative, but precisely because this is a highly contagious disease, the coronavirus has come out of Wuhan in China. We've activated what's called the National Incident Response Centre. In addition to that, any flight and all flights from Wuhan, 3 a week at the moment, will be met by biosecurity and health officials. Information provided to patients, as well as all of the state and territory health systems have been activated to receive patients were there to be an outbreak in Australia, but at this stage, no confirmed cases in Australia.
Okay, are we at the point where this should be declared a global health emergency? And is Australia particularly vulnerable given the traffic between China and our country?
The World Health Organization is meeting on that declaration, and they'll make their decision. We're involved as a country. We have, however, declared this to be a communicable disease, which triggers the biosecurity powers and ensures that we have the officials in place precisely as you've raised. Australia has a vulnerability because we do have direct contact with China, but frankly, Chinese citizens travel throughout the world. At this stage, other countries have been affected and we haven't, but we don't rule that out. That's simply a reality, which is why yesterday the Chief Medical Officer signed the declaration changing the determination of the disease.
Minister, you would have to concede that the timing for this outbreak is terrible, bearing in mind that it is the Chinese New Year this weekend, which will involve the transport of millions of people to and from China. There's 3 direct flights from Wuhan to Sydney every week, 20 flights from China to Australia every week. So is there potential for this to become a crisis, bearing in mind that symptoms might not show up for 2 weeks?
Well, we have declared this as a communicable disease with the potential to spread because there are risks. We should be absolutely clear about that. But the advice from the health authorities and from the Chief Medical Officer is for reassurance. We know that any of these diseases, there's never a good time for them, that a potential epidemic disease can affect any country and it can therefore spread from that country. This one is arising from China. We do have, though, very well established protocols, procedures that when any of these conditions, whether it's as we've seen with SARS or MERS arises, therefore we swing into action with the biosecurity procedures, the pathology procedures, the incident room, the officials, as well as the hospital procedures, and that's what we've done here. And we will continue to make sure that every plane is met, and that we urge anybody who has been in Wuhan in particular, but in any of the other areas which have shown contamination, if they have symptoms, if they have flu-like symptoms, respiratory symptoms which are not normal, then they should immediately report to their GP or to an emergency department and identify themselves for that, on that basis.
Minister, we've seen another health hazard over the summer, and that is the smoke that has been blanketing Melbourne and Sydney. Labor has called on for this to be treated as a health emergency. I know you're doing further investigations as to the long-term effects, but is that a legitimate, prudent call?
Well, I'm not exactly sure what they're asking for. What we have done is to make sure that in practical terms, in real terms, 3,500 what are called P2 masks have been provided to the states and territories, and they've distributed many of them. In addition to that, we've made sure that the warnings are available to both the public, the GPs and the hospitals. Further, we have commissioned $3 million of research on the smoke effects. The advice from the state and territory and Commonwealth Chief Health and Medical Officers has been that they have not historically associated bushfire smoke with long-term effects, but precisely because of the scope of this, that's why we have commissioned unprecedented research to provide the reassurance, to provide the additional information.
Minister, just on to another issue. Front page of the Sydney Morning Herald this morning, a story detailing Cabinet Minister Bridget McKenzie, who approved a $36,000 taxpayer-funded grant for a clay target shooting club without publicly disclosing she was a member. Do you support her?
Yes.
It's as clear as that. You have no questions to ask Bridget McKenzie?
Well, I think that what the ANAO report has done is it set out recommendations, and we've accepted and acknowledged all of those.
Well, it says she's broken the rules.
All up, what it did find was that every project was eligible for funding, and the point that I think would surprise many people is that the outcome of Senator McKenzie's involvement and decisions and deliberations was to increase the percentage of grants in ALP seats from 26 to 34%, and I suspect that most people have not been made aware of that, and that would surprise them. For example, you see in Anthony Albanese's seat, the Dawn Fraser pool received funding. He welcomed that, strongly welcomed that as something which was assisting and supporting his community.
But there is the problem with transparency, though, and I think this is where a lot of the problems are coming into play here, particularly from the public that sees this, and there are a lot of sporting communities who may have been eligible that have missed out here. So is there a problem? Do you admit that there is a problem with transparency here?
Well, the ANAO has made recommendations, and the government will be accepting those.
Okay, Minister Hunt, appreciate your time. I've got a feeling that story perhaps has a little way to go. Appreciate it there from the Mornington.